For my mama Kaba, Eba NewsNowGh TV so. Nene and you.
Say Mubabe mwa eti emren ko bebre eti yense hono ebe mu akwaba de dikan na ya hwese e bi cross ye kokoko patients na wose ye kokko mo no so na ye di sa adwuma no eti nchen hono opani kwan da hodi ananka intu sa na mo.
All right, okay. Yeah, sir.
OPD, if you recall, I know what do Bako OPD. I saw no lab. I saw community doctor and Cassandra.
Also, from Umbechi son or OPD, be a nurses for no. Son, Edward, then if you are now doctor, now if you work out complain, BBR, no, I say, okay, near Koyan, she movie, Mujan, she movie. Now on so home, and I move it to Tihono Nabeba.
Mr. Awudu Isif na oyobia oni abusani bia won nchen de na namfofo na ede ne ba yare ne ba asa no omde meka ne ba nti se ni nduru bia na se ni bibia mokra na information center na omwo village hono ene ke common sense kakra na omde aba na yese na esefo ne hospital hanso kakra ye wono ye de support na aduane di mu ne nyoma makomako bia obehia ti so far and ebusianfo ne de ubi ama so oba abema all classics ubi anhwe ni nti ase na adwen so won so at the same time it is so far and de that is the small thing I bit me
actually Mr. Udo yare ben
confidential kakranti intimi mb so too much yes
so I have to emergency unit.
I'm watching news now, GH. So, and they a new year day in Sarhimon near Namu, and I had the BP I have seen. Now, if I show what to say, let the pa, better has seen a check, Kakra.
About Kara, I don't know me.
No, now, Sarhimu at the same, for best travel near that day.
So, many are
now we are dying now, which are bills, hospital out day. In raw better, Daniel be dean, so benuminano, or you're dying now, which are home bills.
In raw my cotton dear. Sky the fifi banner, the decoto. Munyancha dear, said dear, Moye, Ambajis. Sky cried the fifi banner, a cototo.
Siskana, I buy now, so with me at Jona, Mopeso to him now.
But I do much of my idea. Yeah, cototo, no much of mine.
You won't touch one now, cototo. Okay, so NewsNowGh for has seen a baby more. If you're going to meet your bills in us, so can cry bit to me, a dear boy, no. A bit to me at your family and the bay, a dear boy. In seeing some bay now, catch it one eye, baby or one.
I saw Eddie Comedy at the moment. Sir, Monia, I didn't disaster. Mobile hospital about Abeboa, the woman. In the Yamido Massy. The Monia Sargent, dear, near the Yamido Massy and my coin, new bit me the Abobia. The Yame Edomas.
Yes, yeah, that's Papa, and I more speedy recovery. Say, Yamea do my Bahasing, he and Bambeto say, oh, that I have seen. Yeah, that's Papa. Yeah, that's why on Nkawie Toase Government Hospital near Bepimu, mu emergency ward honum no. Na ipese ene omu twetwe nkomo, ni ehu niam omo ye e wo emergency ward honum no. Abrante be ma kwa baba NewsNowGh GH.
Ba cha mejoso. Na me so medama se omo akonya se ye ni NewsNowGh GH entwetwe nkomo.
Na mi check say emergency ward ha say no. Ne mo be ne ana mo ye wo emergency ward ha say.
Sania odi kan aka no emergency ade bia emergency bia no Nkawie Government Hospital emergency yenso yedi ho dwuma se be accident se be hypertension se be diabetes se be malaria ade bia emergency bia na e wose yenso yeso ano ansana yedi akọ ward ama omonso atoaso no Nkawie Government Hospital emergency yenso ye no hase.
Okay, so into no mo share mo ndwuma mo die no na challenges ben na mo face during your day-to-day activities na mo face dem bia bro ma hoden so na say
ade ba ko pa ndadwin sisia as emergency unit sene aba be hu structural problem say yam ward and say yen building na as emergency na nkasa no is a challenge. She spacing any neman ka yebe hia edi evumbo akọwọdọ no edi akoyejuma be equipment and we have a serious challenge yen face no your hospital has it.
It say if your government say be mo na say nyimeko pese be mo a den na pese mo ka kire sa nyimeko no mo be mo
ade ba kwa nke yebani beji as emergency unit Iowa and Nkawie Government Hospital. I think you building a whole new building and Nkawie well equipped with equipment. I bet me at the Ayajuma problem back as a unit I facing a structure. It's not the best for an emergency unit. It means a building on its own, a well equipped with equipment. They be here for as a unit on its owner in Kiani Bachipa.
Yeah, that's a papa friends say wajibre or NewsNowGh GH. So yes, I call other unit I call her Nyama or Moye or any other patients I bet to me I am boy. Yeah, that's a papa.
Yes, you're the massacre.
Government Hospital. I maybe more children's ward and this year in charge of the teaching community. But more probably NewsNowGh. But children's ward has a very children's ward
medical, surgical cases. Medical cases, if the cases are in here operations, I in learning other therapies and a surgical cases. When you theater bar, sometimes the mobile has seen a Friday morning. My assurance is if you have both medical and surgical cases, trial here and insurance.
If it's a motion, say, you know what I'm saying. Mofa, you know, I'm one of the and possibly, and I say myself, I was a million money,
okay. A higher Abide hospital is never real high, but sometimes you never get to be so far. Maybe Diana, Abide, sometimes you never go by here. And I say, it's so a primary money and cost. Sometimes I can do a plastic chase. I'm home to do we were a real band, the band and the dapper is for a bad source. Yes, they are you make me say, and I say a best say, moving a mattress is crying out because Mamma now and fire. Let's only see a comfortable capa. When you're so you're with me in your holiday today, Ashley money. It's plastic chase, and you try if you book a car, and sometimes it's a young 50% convenient mattresses. Meeting the after to say they are not doing the bad activities near seeing Sakra. Now, it is sure. And sometimes in chronic people, however, not only insurance, most of them will be free. It's free Sakra and a back to the grassy and if you need insurance, Sometimes ke be suggest say dia ke nya welfare foundation dia they be sika betra ato ha mo for future you to be balance with him mo dia maybe dia support your welfare ni dia support mo be ne mo ba be na manye
you know culture about any other stakeholders from different from your
say on run on ba me mo because mo pa no mo so ya so so mo so mo ye da ni da so on run on ba me boy dia
So we're still here at Nkawie Toase Government Hospital, and then we are at the children's ward. We had a conversation with the in-charge, Louisa, and it's basically about lack of infrastructure at the children's ward. So they are calling upon all stakeholders and the government to come to their aid to provide them with the beds, the mattresses, and everything that they need to make their services very, very, very efficient and effective. Thank you so much, Madam Louisa. Yeah, that's what on Nkawie Toase Government Hospital or Children's Ward has saying. Na ibe pie mu no yehu mami bia ne ba oxygenating so. Ye pese ni din komo ni yehu obeda has saying no ache anase nche. Mami ma wakwa baba NewsNowGh.
Yeah, no, it's the.
Pachone fro saying.
Pacho from Philippa.
Philippa na oba no beda has saying ache kakra na.
Pacho any 4 days.
And any 4 days no beda has saying. Na ne di demo ne matua mu ne ai ni nro to no ekosen
Pacho minye scam from
kan fanto yi so oba ha sen ni nro ne di demo ne na no unti ahwe
Pacho le
ahwe. Okay, NewsNowGh for wa say ba be ye wo moa e bia yentimi ntia wo bills ni na be betimi tia kakra enti no den na wo ka share NewsNowGh any adofo mo wa bonti am person be so e ba be ye wo moa
Yemetumi aka cho mu nyina nsa nyame enhyira wo mu. Anya nipa nyina na betumi aye de mo ye no. Nyankopon enhyira wo mu nyina. Ba bi o mu yi sika firi ne bia Nyankopon enhyira wo mu na mu.
Yeah, that's a papa so wajibra ma NewsNowGh. So Nkawie Government Hospital is calling upon all and sundry, all stakeholders, the government, to come to their aid in terms of paying their expenses. You can help in aid of food, drinks, anything at all that you can support them with. They are so grateful to receive your kind gesture. And it's not about only this woman. Every patient here in Nkawie Toase Government Hospital is calling upon everybody who, one way or the other, can support in paying their expenses and other stuff. Thank you so much. Welcome to NewsNowGh.
Cherished viewer of NewsNowGh. It is because of you that we are currently. I am in the office of the Deputy Administrator, Mr. Rashid Yakub. I am going to give you a live interview that will purport to speak about the questions you had wanted to ask. And I must say that this show that has been going on here, the program was suggested, the hospital was selected based on the recommendation by a junior staff. He is at the health information department called Kobina Ayebi. He's a native of this town. He recommended that NewsNowGh should come to the aid of patients at this hospital. And so in this interview, the administrator, the deputy, will be speaking to some issues. Good afternoon, sir.
Good afternoon.
I'm next Ado, your name?
I'm Rashid Yakub.
For the sake of those listening, I've mentioned your name. You're a big man. You're a big man.
You're a big man.
How you been taking us through the centers and so forth? I must say that we are grateful.
You're welcome. You're always welcome.
And one thing I noticed, what is the secret in health when it comes to cleanliness? Because it is something you have been doing so well. What is the secret?
See, hospital setting demands a lot.
That also suggests psychologically that when he is out of the hospital, he has the feeling that he's going to be there.
not. It depends. It depends. But you see, we believe that having that clean environment contribute to the patient recovery. You get it. And hygiene is something you and I know that once we find ourselves with an environment which is not clean, it contributes to our sickness. And therefore, we've been, throughout our education to our clients, we inform them to keep their environment clean in order not for them to get sick. I hope you are getting me.
Will you say that hygiene, the lack of it, or the inadequacy in hygiene, it's something that led to the spread of COVID-19 or some of the infectious diseases at this facility? Because we visited one patient who has been stricken by illness because of infections.
Oh yes. So you see, area of COVID, COVID, it has its own genesis. But the issue, let's assume somebody comes with the issue of malaria. It means that the person place of stay, there's a lot of things that the person should have done in terms of cleaning the house, bushy environment, which might have breeded mosquitoes. So with this and other issues, contribute to some of these things. Yes.
Okay, so that is just by the way of letting our viewers know what will lead to illness that will lead to you being taken to the hospital.
Yes.
And whether or not you are going to be able to pay your bills. We have health insurance in operation. Is it still active? Is it still in operation?
It's still in operation. It's very active.
And so how come people are still having issues of non-payment of bills? Is it that the hospital is not taking it, the cars?
We do take it, and it will interest you that those who are not able to pay their bills are the very ones who do not have health insurance. And sometimes you ask, why? You ask them, why? Why did you have health insurance? And if you deep inside, you get to know that they're even paupers. They don't have somebody that they can even rely on in terms of such difficulties. And sometimes you ask again, so why have you stayed all this while? Why don't you do it? And the next thing they tell you, don't have money. So for me, patients who are unable to pay their bills, not because of health insurance, all of them don't have health insurance. They are basically non-health insurance members.
The discerning viewer of NewsNowGh want to understand. In the instances where I have health insurance card, I bring it to the hospital. You tell me that this and this is not being covered by the scheme. I am financially handicapped. What do I do? What does the hospital seek to do afterwards? Is that you are going to take the rest of my bills?
Come again.
I'm saying that assuming I come to the hospital today, I am financially handicapped. I don't have money on me, but I have the card. But my understanding is that we have some aspects of diseases, some medicines that the card, the scheme does not cover, do not cover.
Can you be specific?
Things like the oxygen, does it cover? Does NHIS cover oxygen?
Okay, let's do it this way so that it can be well understood. The NHIS is very good. We even advocate that all patients are supposed to have it. But in the case that, let's say, there are some labs, chemistries, which do not cover. Okay. Patients, we do talk to patients to understand that this is the situation. And mostly we have the social welfare that comes to their aid. The district, we have that relationship with them. So usually come to their aid and help. Yes.
I am coming from, or the listeners of NewsNowGh will tell you that there will be a patient coming from a very financially stricken family. It means that he will not have a person to pay anything excess of the card, the scheme, NHIS. So when that happens, what do you do as an administrator, or what does the health facility do when at the hospital, I have the card, but some must feel like you just mentioned, I don't have the money to pay, so what will you do? Is that you will leave me to die?
Oh, not at all.
So what happened?
We do take care of you. And by the law, within 24 hours, you must provide services to the person. And we have a number of them who come in without anything. In the case of accident, in the case that a person is rushed from home, nobody's even there to pay anything. The hospital do take care of the person. And in the case that the person is not even able to pay, we do sit as an administrator, we do sit with the person. The person will go and then later come and foot the bill. You see, we make them understand that the healthcare facility is such that whatever we use on you, another person will have to come and the same thing will have to be used on you. You get it? So whatever bill that you have, we talk to you, you're able to pay, let's say half, there you go, then you come and pay back. We just take details and we have that good relationship with our clients.
If you just tune in, you are just watching an interview with Deputy Administrator Mr. Rashid Yaku at Nkawie Toase Government Hospital, diving into the plight of the financially stricken patients at the hospital. So I'm still asking on this same question. I still do not have, if you give me 1 year, I will still not have money to pay. Is it that you're not going to discharge me?
You know, there are some people who declare them paupers. It means that they can pay. What can you do? The health of such person is also very important, that you can't let the person die. So it becomes a bad debt. In the case that we are not able to treat the family, we also link with the social welfare. Usually they do help a lot. But in the case that they are not able to do what they have to.
I'm tempted to ask this. It may be emotional, but then, since you started working as an administrator, has there been any time that a patient gets into this trouble and you are like, you were not able to see the patient die because of maybe a penny, and it comes to the extent of you, taking money out of your pocket to pay? How was that scenario like? Try to narrate something to us.
Countless times. I'm happy when we went to the isolation unit. The nurse made it known to you that we do contribute. You are there and you come administrator, this person you can't pay. And you talk to the person and you realize that apart from the bills that the person owes, even when he goes out, he can't have anything. In that case, you need to pay the bill yourself, because you cannot say everything should be free. You can't just say right, free, let people. So you give money out to pay the bill. When the person is even going, you need to also give something to the person, so that at least it will not be the person who go and the next thing that the person will go. You have a series of a number of them.
To the extent that you are not even able to isolate one to speak about it.
There was one client, the name. As of now, the family will be forced. The fellow came in and they are going to the parent. See to drugs, said tramadol or something. That was last year. And the person was rushed in. They didn't have anything. So I had to come in. And I even made a follow-up to where he stays, to ensure the boy refrained from stepping out. And
you knew him personally?
No, I didn't. Wow. Because looking at the parents were worried. Whatever they have to say, they've said it. Whatever they have to do, they've done it. But still, nothing good is coming out of it. So I remember after he had been discharged, I brought him to my office, spoke to him, at the point of me telling him that if you do what you did again, I'll make sure that you are being arrested.
Okay, so
nicely,
if I understand, he was on drug.
Yes, he came with other issues, but some of these drugs also lead to one way or the other. Mm-hmm. And then I made a follow-up, and now I would say they do call me, and the family will appreciate what we did. Yes, and the nurses too, they do say there are a number of patients that they provide for them because perhaps none of their relatives are around, and sometimes you have them coming back to them. I'm the one you took care of. I'm the one you did this. I'm the one you did that. And the nurses are always happy. Sometimes they see them in town and they are not even able to recognize it, but the people recognize what they do.
Just by way of concluding the interview, it will surprise you that this contribution, our viewers did this contribution, starting from 1 cedi to 500 cedis, within that range, over thousands of them. I am asking you to tell them something by way of maybe appreciating on behalf of the patients. And by way of doing that, put forward to the public or mind viewers, the cherished ones of NewsNowGH, that what exactly state some projects, something that they should come to aid of the hospital. Because when we went to the children's ward, I was made to understand that the parents that brought the kids, they are not on health insurance, and the kid is not also having. So some of these things, concluding the interview, you can end it with that.
Okay, I would want to say a very big thank you to your viewers on behalf of the Medical Superintendent, Dr. Atwima Nwabiagya Municipal, the staff, the management, and the patient that you came to their aid. In fact, it being a new year, I believe that is a special new year for them because none of them ever thought someone would come to their aid. And it being a hospital,